let's say you're not getting to the point of having this type of pain, but the pain is so constant that the patient becomes chronic infection, because then they said, oh, you know what, doctor, I'm taking painkillers. So this comes down to painkillers addiction. Why? Because then the body starts having pain constantly, and the patient tell you the story, oh, I've been taking ibuprofen, I've been taking Tylenol, I've been taking Tramadol, some of them Vicodin, Percocet, hydromorphine, nothing stopped the pain. You could be on a risk to be having a pharmacodependency, meaning that now the body knows when they have pain, now you need the painkiller. But none of these medications sometimes will stop the pain. You have to seek help immediately, because it's not good to have a chronic infection that it can become acute. And again, any big infection, especially swelling, you can end up with a septic shock. So you have to run and seek a specialized endodontist that can take care of your problem in the tooth. Because the nerves don't have these nerves around here and the surrounding area, only the root of the teeth, they don't have proprioception. And when you don't have proprioception, what is the meaning of, oh, they don't have proprioception? Meaning you don't know where the pain is localized. So the patient can have pain in this tooth and then can feel the pain on the other tooth, or maybe in all the teeth. So what are we gonna do from this situation? Well, we have to go to the dentist and ask them, please check if I don't have a cavity. The problem continues and it gets worse when the infection and the bacteria keep increasing. Remember, they grow up in big families every 20 minutes, and they continue, and then they start creating an infection in the surrounding area. So when we say we don't have a wider vision as a dentist, as a specialist, as an endodontist, not only we have to focus on the canals, but also in the surrounding tissues. So the patient now, when the infection gets to the end of the roots and gets to an abscess that is gonna go to the end in these areas, then now it's an abscess. Now the surrounding tissues are affected, the gum, the bone, the ligaments. And when the patient now is gonna have pain on chewing, is gonna have pain on biting anything, even if it's not chewing food, is gonna have pain even to touch the tooth. Sometimes the patient said, oh, I feel like a little meat inside my tooth, and that's called a polyp. I remember it's from dental school. And nowadays we say it's a root canal or not root canal. Here the pain starts lingering, and it's usually spontaneous, and it gets worse at night, and it's constant, non-stop. We're gonna talk about what is the meaning of these symptoms very soon. Night pain. If you experience pain in the middle of the night, let's say you're sleeping, one of the keys for us as an endodontist to know if that patient is gonna end up having a root canal, comparing with the x-rays, diagnosis, etc., is when the patient called you and said, doctor, the pain wake me up at night. So if the pain wake you up at night, if you have more pain when you are laying down, if the pain is constant, non-stop, you can hardly understand where the pain is coming. Now you have a headache. Even thinking about what I'm gonna do, where I'm gonna go, because nothing stopped your pain, you are gonna need to seek immediate help. Especially because if your face is not swelling yet, what is happening at that moment is that the tooth gets inflamed like this. We call this hot tooth syndrome. When it's this inflammation, the pain wanted to jump out of the window, or they said if you're in a plane, you want to jump out of the plane. However, when it goes to get to this point of infection, that's when you have to extremely be careful that it doesn't go swelling. If your face starts swelling, you will need to run to the emergency room to get an antibiotic or maybe IV antibiotics, especially if you start having fever, because you can die of a septic shock. Number 3, even if you went to the endodontist and the root canal looks like an image like this and everything it was cleaning correctly, but now you're having throbbing pain nonstop and the tooth feels like it's floating around and you cannot even touch the tooth. The pain is so bad that if you touch it, you will jump. You cannot put the teeth together. You cannot bite. That if you try to put your teeth together like this, then you cannot, because you feel like there is a cushion in between the tooth and the ligament. That is also a sign of a huge infection, and you have to seek help immediately. If not right away, hospital type, then you have to see your endodontist the next day, or to see your dentist and see if they can start doing some type of drainage in case you have a fistula in the tooth. It's not normal, and maybe it's not even from the same tooth. Maybe there was a restoration on the side of this teeth, and then they have to look if there's another teeth that is having a problem like that. You can ask your dentist to look for food impaction, etc. And the last, our number 4 warning is, remember that if you feel the tooth, as I said, it feels higher than the other, like you try to close, but you feel you cannot close it, that you cannot even put the stick together because then you're gonna develop pain, just even by touching, that means it's a huge inflammation and you have to take care of that tooth immediately. Is the inflammation that is around the surrounding tissues, and if you have a fistula already or like a pimple draining outside the tooth, you have to seek help immediately. I want to conclude with this warning to everyone. When you are experiencing dental pain, whether you have a root canal or you don't have a root canal, and your doctor is not listening, you have to tell your doctor that Dr. Yacaman said that your pain is very real. Nobody goes to the dental chair or to the dentist to spend their time of their life or relax. In my office, I make them laugh, but they come because they have a problem. So if you're experiencing all these symptoms, it's really important that if you feel that you're being ignored, then feel free to find a second opinion. Talk to the other specialist. If that second specialist doesn't answer your questions, seek for another one until you find the appropriate person that can dedicate you the time and the quality that you need to have a good diagnosis and find out where the pain is coming. So many patients have come to my practice suffering from migraines that comes from a tooth, and vice versa. A patient that has a migraine can be suffering for a toothache. Again, I have my episode on refer pain, and you can see more expanding information about these topics. Sometimes they feel, oh, I have a jaw pain, and they think it's because of the tooth, and it can be grinding and the lack of using a night guard. Some of the patients have constant headaches or constant fatigue. I have so many patients that said after my root canal, I am not tired anymore. And it's because you keep a chronic infection in the mouth around the surrounding tissues that is creating a problem in the whole circulatory system. Remember this tooth and this nerve are connected with the cranial nerves of the brain, and they're connected with their whole body. So when your mouth is not in perfect health, your overall health is gonna be damaged. So if you have symptoms and you feel it's coming from a tooth, be sure that you seek a specialist that is listening to you, and it will take care of your pain. If this video helped you, or you identify yourself with this type of symptoms that we described through the whole episode, just remember one thing: you need to be heard. I always said that our patients are the most important part in our professional life. I go overboard listening to my patients, but when you don't have a doctor that listens to you or a specialist, you need to find another opinion until you find the answers that you're seeking for. But don't let anybody say, oh, it's your pain. No, it's not true. You're making it up. You're crazy. Your pain is real and you need to be heard. So remember, if you identify with any of these, share your experiences at the dental chair with me and let us know if you like the video. Put a thumbs up, because we're gonna bring you more episodes. We're gonna teach you how to take care of your teeth and avoid dental problems to get to this point. Thank you, and I see you in the next episode.